Welcome back, everyone. It's time for another Eye on Vision segment with Dr. Mehta is joining us from Retinal Research Institute. Thanks for joining us again. We've got some questions from social media. A couple questions. One here, Claudia asks, I would love to know more about birdshot eye disease and its long-term effect, and what's the possibility of passing it on to children or grandchildren. Where's this?
Yeah, so birdshot has a funny name, right? Yeah. But it's actually a clinical diagnosis. It's a common, actually it's not so common, it's a uveitis, which is inflammation within the eye. Typically, birdshot affects the back of the eye, the retina, and the choroid. And the retina is like the light-sensitive tissue in the back of the eye. Without it, we can't see. And the choroid is layered behind the retina. It's very vascular. And what happens in birdshot is the immune system gets hyperactive. And it starts to cause inflammation in the back of the eye. The reason they call it birdshot is because the inflammation is in a scattered pattern in the back of the eye that looks like birdshot from a shotgun. And so it's part of a general group of diseases called posterior uveitis. And the way we treat that is with prednisone. Prednisone is a steroid. And prednisone works great in the short term. The problem is long term it can cause a lot of side effects. So we tend to use other drugs to give more long-term stability for this disease.
Is it contagious, or can it be passed on to family?
It's not contagious, so it's not an infection. It's an autoimmune process. And it can't, as far as we know, it's not typically passed on from generation to generation. So
that's good.
So yeah, so my thought is, again, it's not a very common disease, so we can't really research it that much, at least in large quantities. But at least in the small case reports that I've seen, there's no inheritance, meaning it's not passed on from generation to generation.
That's good. But with inflammation, it sounds like it would be painful. So a person would know if they have this issue.
Well, the most common symptoms actually are, it's not pain, it's blurred vision, floaters, and something called nyctalopia, which is night blindness. So it's very difficult to get around and see at night.
Okay.
So those are the most common symptoms of the disease. Again, it's not very common, but if you ever have any issues with your vision, I mean, you just got to go in and get it checked out. Because the sooner you can treat something like that, the better. If you let the inflammation continue, it could cause some permanent damage to the body.
Oh, okay. Good to do. Good to know. Okay, another question. Frank asks, with the aged population, Arizona doesn't seem to be on the cutting edge of research for age-related eye disorders, such as MACTEL and others, as other areas in the country, such as California and Florida. Much research seems to be going on in Europe, especially the UK, with the USA trailing behind in research on these diseases for the aged population. Is that true?
Actually, it's not.
Oh, okay.
You know, the U.S. is, as a matter of fact, on the cutting edge of research, especially when it comes to retinal disease. The reason why it might seem that way is because it takes a long time to get a drug through the FDA. You have to go through multiple phases of a clinical trial in order for it to get approved. And so often it just takes a little bit longer, and that's just basically to protect patient safety. That's why it takes longer. In terms of Arizona, we're actually at the forefront of retinal and vitreal research. As a matter of fact, the Retinal Consultants of Arizona and the Retinal Research Institute is in Phoenix. It's one of the largest retinal and vitreous research centers in the entire country, and it is the largest in the Southwest. So it's right here, right in Phoenix, and all the patients, whether you're from Lake Havasu, Bullhead City, Kingman, you're going to have access to those clinical trials if you're interested in something like that. That's great.
Yeah. So Frank, make note. Retinal Consultants of Arizona is on the cutting edge. Tell us a little bit more about the Retinal Research Institute. What diseases are currently being studied?
Yeah. So the Retinal Research Institute is affiliated with the Retinal Consultants of Arizona. And like I said, it's a very large clinical trial center. We're studying diseases such as age-related macular degeneration, both dry and wet, retinal vein occlusion, diabetic macular edema, uveitis, like I mentioned before. We have some really interesting clinical trials. And the beauty about being, the great part about being in a clinical trial is that you're getting access to a drug that might not be available for like 2 or 3 years, and you're getting it basically free of cost.
Is that clinical trial open to everyone, or do you have to qualify?
You have to qualify. There's a screening process, and depending on the severity of your disease, depending on your visual acuity, depending on your medical history,
Okay.
You have to pass through a screening process in order to be eligible for a clinical trial.
Okay, that sounds good. Okay, well, that's great to know. That's right here in Arizona.
Yeah, and
for us.
Yeah, and I'll also tell you that with these clinical trials, it might seem like you're a guinea pig. You're getting something that's brand new, but you're always going to be under the direct supervision of a physician.
Of course.
And so it's very important to know that we'll never let you fall behind. If you're not doing well with the clinical trial drug, we'll get you right back on standard of care.
Right.
And you'll never get a placebo unless there's no standard of care for a particular disease. Then you might get a placebo. If there is a standard of care, then you're going to get at least that. If not, you'll be getting the clinical trial drug. So.
Okay. Thank you, Dr. Mehta. Great information. If you have any questions about retinal disease, want them answered, you can go to communications@retinalconsultantsaz.com and send in your questions or give them a call at 928-855-5026. Thanks once again. Great information.
Thank you so much. Thanks for having me.